From pretty much the start of the pandemic, contact tracing has been an important tool in helping to reduce the spread of the virus. New York and New Jersey have now joined a handful of other states in launching contact tracing apps for COVID-19.
And joining us now with how these apps work and whether users should be concerned about privacy issues, tech consultant, host of the podcast Think About This, Shelly Palmer. Shelly, good morning.
Good morning. How are you?
Very good, thanks. Good to see you as always. So first and foremost, for those who don't know, if they've been living under a rock, tell us a little bit about contact tracing in general, how it works.
Contact tracing, which is also known as exposure notification, is one of the oldest and most effective ways to mitigate or contain a virus, right? If a few people get a virus and they go to the hospital sick, and of course the doctors will ask you, where were you? Who'd you come in contact with? Hence the contact tracing. We've now got to a point where there are millions of reported cases and we're doing millions of tests worldwide. But in New York, New Jersey, Pennsylvania, and Delaware, the governments have come together and they've adopted Google and Apple's technology in state apps that you can opt into from the public health department. And this is an attempt to do digital contact tracing in an anonymous way.
Now, Shelly, should we be concerned about another piece of technology kind of following our every move? It just it seems a bit like, you know, you mentioned earlier, a Big Brother type thing.
So I don't think this is a concern anyone should have. The phones, by the way, the amount of data you share with commercial organizations every day, whether you know it or not, is gigantic. Name, location, where you are, what you buy, what you do, all day, all night. These apps are particularly secure when it comes to who you are. You're fully anonymized. The phone gets an ID. If you opt into this, you download the app and you opt in. If you go and you get a COVID test and you test positive, your phone is given a code. Now, other phones that come in contact with your phone within 6 feet are notified that they've been within 6 feet of a phone, but the location's not captured or disclosed, and you are fully anonymous. It's really just proximity to your phone. And the goal here is to let people know it's truly exposure notification more than contact tracing, because they're not giving you the name of anybody. They're not telling you even where it happened because they don't know. It's simply that your phone was in proximity within a 6-foot radius of a phone that belongs to someone who was exposed. So therefore you are potentially exposed. Doesn't mean you're going to get the virus. It's just a way to notify you that you've been inside a circle where there's known contagion.
Interesting how the technology works, Shelly, but it seems like you have to opt in order for this all to work, right?
You do. You have to download the app. And actually, you know, I don't ever like apps where it says, and just click here and just do this and just do that. This app is really simple. You download it and it works. If you get a test, your phone can get a code with the results, and you fully opt into it. You need to do nothing. It runs in the background. You don't need to turn it on. Once it's on, it's on. So that all works just fine. It couldn't be simpler. The question is, are you willing to contribute your data? And are you willing to be in a situation where you are notified? The bigger question is, what will you do when you're notified? If you can quarantine for 14 days, should you? Should you go and get tested? There are health guidelines about this, but don't worry about the tech. The other thing is, this is only going to be effective if a lot of people download it. So they're going to have to do a big job promoting it, and making people aware of it isn't just going to do it. They're going to have to show some real benefits. People are having their lives improved and the quality of their care improved. We know that the earlier that this is detected, the better off you are. But remember, there still is no cure, and the best way to deal with this is not to get it.
All right. Tech expert Shelly Palmer, always great to see you, and thanks for breaking that down for us. We'll see you next Tuesday.
You bet.